I'm Nancy Phillips. I coordinate the Illinois Family Resource Center, and Christina Banda, who's our education coordinator, is on here with me. And we're going to do a workshop. It's actually a two-part one, and I will tell you right now, I'll probably take a 5-minute break between them because I think when you're in for an hour and a half, I have found looking back through some of the sheets and time things, people have a tendency to drop out after 50 minutes to an hour because you're tired of sitting. I'll give you 5 minutes for that break. And because we're going to do this in two parts anyway, what we're doing today is time for a family update moving into adulthood. Those of you that aren't familiar with the Illinois Family Resource Center, we have been here, let's see, it'll be 11 years, April 1st. And this started out, surprisingly enough, as a 1 to 2 year project that was funded through federal funding, and Super took it over as that funding left because people seem to have such a need, and there is a need, focusing on families and the impact of substance use disorder and those co-occurring issues. And that's what we're all about. We don't do clinical. I'm qualified to do it. I did it for years. I've been in this field over 40 years. And a lot of that time, I also spent a lot of time with Prevention First in the early years. And I've also done supervision of clinical services and everything. But my real passion and my real love has been when the Illinois Family Resource Center became an option for me because I so believe in the need of families being a major part of making our families and communities on a recovery journey from a lot of the craziness that we see of the impact and chaos from substance use disorder and co-occurring. And I'm also a family member. I say I have lived experience. It's not from experiencing substance use disorder myself, but it's living in that through all my different areas of lifetime. My father, my husband, who's got over 40 years of recovery, folks. It works. Treatment works. Family involvement works. I have a son that's got a lot of years of recovery, so I went through a lot of that emerging adult that we're going to talk some about today with him. And I also have a grandchild that's experienced substance use disorder. And as a result of that, I'm one of those grandparents that has done 2 rounds of guardianship of 2 different generations. So there's a lot of experience here that you can bring to this field without it being a diagnosis of a substance use disorder yourself. And we need to look at that. How do we support the families and how do we um, educate? And that's really what today's all about, is looking at how we educate. We're going to do the first part, we'll be looking at some of the newer data on the emerging adults and go from there. But what we do as a resource center is not clinical, we're a resource. And we can do it addressing SUDS, addressing mental health. Our house that holds the contract for us is in Charleston, Illinois, just right over the Indiana border, right in central Illinois. And we have Eastern Illinois universities here. So we have a really kind of diverse and interesting culture and experience in our area. We provide information for anyone that's interested in the state with definite focus on uh, the Division of Behavioral Health and Recovery, which is super and mental health as we came together in July. But we interact with all these other organizations statewide and in different areas of the state because that's what we're for: welfare workers, schools, all those things. We are here as a resource center. How do we help everybody from our little babies to our seniors that are impacted by substance use disorder? And thanks to Christina, a lot of our services are available in Spanish. So if that's of interest. Whoops, let me see if there it converted. We have website postings. We have Facebook page that's updated daily, and even Christina does a lot of posting ahead for months of special events that are going on. You are now participating in one of our regularly scheduled webinars that we do. We also provide webinars just because there's a diversity in the people that are on here. I want you to know that we aren't tied just to the webinars that we do. And we have wonderful consultants. And I know one of them that's got a webinar coming up. Lisa Winger is on here, and she's going to be doing a great one on sex trafficking, maybe. I don't know what else to call it. Family sex trafficking. We have, we do some of those in Spanish. There are some available in Spanish if you want them, but this is our regular webinars. We also do, if there are providers or organizations that want a series of webinars, we can do that. We have two that we do monthly webinars for their staff that's focused definitely on them. And that's very similar to the technical assistance that we can do and facilitate planning or those kinds of things that are impacted. Get involved. I do anyway on my end, a lot of planning for conferences, for events. I've got coming up in February several things looking at some collaborative learning processes and things, and this is exciting. That's what we're here for. And we don't do clinical training, and we don't, well, I kind of do in some areas, but we don't focus on that. We focus on how we support the families and what are all those different areas and how we get people out of the silos and out of this is our area, this is our area, this is our area, and we're all struggling to work on the same thing when we could be working together and have a dynamic response. And that's what happened with the Circle of Care, which has a long history, and I'm not going to go into it now of how it evolved, but it's exciting. And we had a wonderful team that spent a year working on developing resources that are absolutely phenomenal on the website. And I encourage you to go to the website and look at the Circle of Care. It addresses grief and loss of youth. And of course, you have a ripple effect. So it also impacts the families and the adults that are in their lives too, on how you work through grief and loss as it's related to substance use disorder. And that may be through incarceration, it may be through children being removed from the home, which causes a great sense of loss and grief for children. Um, I know that because I ended up with guardianship and under those circumstances. And then taking a look at how do you face the loss through death from an overdose or substance related death. So we've got a lot going on, let me tell you. These are just flyers. I didn't have a chance to update them. We just did this one right here with Mark Sanders 2 days ago, and I know several of you were on that. And Mark's just great. He had done this one, a similar one to us for us before, and I love the people that work with us. We're very fortunate. The plan for the day is I'm gonna move my image here that's in my way. The plan for the day is I want to say we're not doing clinical on how you work with emerging adults. We're just kind of doing the first part of this webinar will be taking a look at it, taking a look at some of the newer things that have been identified that we need to look at as young adults, emerging adults, maybe experiencing substance use disorder and things going on in their life because there's kind of some interesting things that 20 years ago we would have gone, no, we're not doing that. And as we've watched the resource center evolve, we started out focusing on adolescents, then the funding efforts changed to what is now considered emerging adults. And it has just, I have been part of this watching it grow. And so I think it's just interesting that we get to do this overview and share some resources from a couple of places that kind of throw some new light on how do you look at that. I mean, in two instances, have been a part of the family of an emerging adult that experienced substance use disorder. So that's kind of where we're going with this. So if you're looking for actual clinical, when you sit down in a session and you do this, that's not what this webinar is about. But I want you to keep your mind open and sit back and take what you can from what we're going to do because we've got until noon. We're going to review the environment created for young adults. We're going to look at the understanding of the issues related to the brain development and where emerging adults are, especially in relationship to substance use. Generate some ideas for working with the unique needs of emerging adults. And then the last half of that we're going to do is we're going to review the NIH SAMHSA parenting caregiver prevention model called the family checkup. Positive parenting prevents drug use. I love, love, love this. It's been out a number of years. It's you can't order the publication anymore, although it's still available online, and the content is really useful. And it just seemed like a good way to share that, so we put those two together. Emerging adulthood. I have been talking so much this week, I get a little tongue-tied and I'm losing my voice. So hang in there with me, folks. I like this diagram more or less. Looking at adolescence, we always thought adolescence really at 18, then you suddenly became young, the young adult. But there has been identified with research, especially since, I would say, just since the year of 2000 when Jeffrey Arnett came out with a lot of his work, looking at emerging adulthood, that 18 to 25 year time is and needs a stage of its own moving forward. Contrary to the misconception, emerging adulthood is a fundamental period. It is an identified period now, a biological and psychological maturing, and it's a really important part of going from being a teenage adolescent and moving into adulthood. And a lot of that came around what we found as the research came out about brain development. We used to think, oh, by 18, those neurons were grown, the brain was ready to go, et cetera. We know now that even some of the most vital parts of the brain around solid decision making and transitioning into adulthood is really not done until 25, and there are some studies that even push it to 30. You will notice, I'll just mention this as I go through this. Those of you that were in Tuesday's webinar, some of the information, and as I put in and do have done some looking up information on emerging adults that I wanted to pull into this as we've worked on it over several months. You see Mark Sanders. This article keeps coming up that Randy Weber, who I have an absolute admiration of and have known for 35, 40 years, the same with Mark. I've known Mark since both of our early days in this field. We're part of publishing this on emerging adults. And when we send stuff out, I will link you to this article because I think that you will really appreciate it. I also found that Chestnut Lighthouse Institute had some really good information on emerging adults, and I love this slide, so I borrowed it. Looking at the functional abilities that increase with the psychosocial development as you move through the emerging adulthood, and what are some of the roles that period is important to have, and substance use disorder can certainly get in the way of it. Contributing to or being the head of a household, becoming financially self-supporting, completing schooling and training wherever you're headed. Because as you come into your adolescence, you really wonder, who am I? What am I going to be? Where am I supposed to go with my life? During this time, you'll develop one of the strongest social networks you have, and is that positive or negative? It can go either way. One of the other responsibilities is to be a good citizen, give back to your environment, to respect other people, etc., and then obtain and maintain rewarding work, no matter what that is. There's no judgment into what it is, but that's part of a positive psychosocial development during those emerging emerging adolescent, same thing, I guess, emerging adult years. Emerging adulthood is a period between late teens and early 20s, at 18 to 25, and I mentioned Jeffrey Arnett a while ago. He came out with a lot of his publication and work in real close to 2020 to 2000. He states that emerging adulthood is neither adolescence nor is it young adulthood. That's why there needs to be an identified time as we look at the developmental stages. And both of the resources I just mentioned, the Lighthouse Institute and the work that Randy and Mark did, and I didn't know the other people that were in that article. I hope to meet them or have more of an identity at some point in time. They all agreed in what they put out with Arnett's philosophy, with his research, with his statements around emerging adults. He says that they have not taken responsibilities of adulthood, and it's a greater time of exploration of the time ahead. It's that segment of making the transition. And a lot of what occurs during that time is very stressful. As I well remember, I was a mother at those points. Jeffrey Arnett has 5 characteristics that he has identified as emerging adults, and it really separates some of the work and developmental things that we know from adolescence into a young adulthood. And those are the age of identity exploration, age of instability, the age of self-focus, the age of feeling in between, and the age of possibilities. Whoops. Well, I certainly gave the Division of Behavioral Health and Recovery double credit on this slide. The age of identity and exploration. Today, most identity develops in the late teens into the early 20s. It's a time to explore career choices. We know people of my generation would get in a career and stay forever. And we see a lot more exploration with that during those earlier years and looking at careers and where I want to be and what I want to do and how I'm going to get there. Forming ideas regarding intimate relationships. That has shifted a lot over the years of what's acceptable even in our cultures and society. But that is one of the things that is very primary during those years. And it really is a time for setting foundation for a solid adulthood. Age of instability. Exploration creates uncertainty and instability. I think of the people that I have experienced in my life that go through this stage, and it's certainly a time of, do I want to do this job? Do I want to do that job? If I go to school and I start to major, if I choose to go to school outside of high school or whatever, because you hit that 18-year point, and I start on this, and then, well, I'm not sure this is what I want to do, so I change my major, or you start one job in one area of service. There's just lots of uncertainty and instability, and the brain is still developing on top of all this. They often change jobs, relationships. You're more likely to bounce through relationships at that age and living situations more than any other time, more than any other stage. The age of self-focus, adolescence. There's more self-centered, are more self-centered than emerging adults. You're starting to feel a little more comfortable with yourself. Emerging adults concentrate and are aware of and they consider feelings of other people. They're more in tune to that. They aren't quite as self-centered. Most of the time, I would agree with that. They begin to see their parents as persons, not someone that is in that parenting role that which is kind of neat. I having raised 3 children and then raised 2 grandchildren into adulthood. As that happened, as they begin to regard us as people, not just parents, that was an exciting time, and an exciting relationship. It's not always easy to navigate that, though, because oftentimes there's, especially if the process has been stressful, if there's issues between the parents and the child as they grow into this phase of their life, it's not always the easiest thing. But there's more focus on themselves since they have fewer obligations than when they move into the what we call the young adulthood stage now. The age of feeling in between. There's a yes and no feeling of being an adult, and this came out in several of the resources that I looked at, that there's just that uncertainty. They feel pulled back into that more adolescent issues at times, and then they know that they're being pulled in and need to take responsibility for other things. And if they are using involved in substances and stuff, they really will bounce back and forth. They no longer feel as dependent as they did in their teens. And a lot of teenagers really think that they're much more independent than they are, as people that have raised teens well know. It's not an easy time. Emerging adults may be financially independent, but still in need of parental help. And I think that that shows in in a lot of the culture in our country. You know, you may have a job, but you're still living in mom and dad's house or with some family member, not totally independent, but basically paying your own bills and oftentimes need a really more emotional parental help than other things. That feeling of in between, only having attained some of the adulthood indicators. And I often think that when I look at this and as I've read through things, kind of to me refers to you're coming into this independence. I'm 18, I'm on my own, or I can be on my own, yet maybe I'm really not ready. I'm not sure what direction to go, but I have these goals and you don't get there as fast as you think you should. Um, Oftentimes that's a really negative impact on the development and behaviors that come out of this age. I've experienced both in my family and within the environment that I've worked in. When I coordinated outpatient services, we had a large number of what at that time we weren't calling them that, but the emerging adults. And I look at this and I see a lot of what they went through and the impact that their substance use had on even going through any of these things in a healthy manner. 60% report that in some ways they feel like an adult, but not completely, still in that in between stage. And this one, the age of possibilities. This is a time when dreams are yet going to be tested. And that kind of goes back to some of the things I mentioned earlier. I go to college or I go to vocational school and this is what I want to do and I'm there for a while and after I've tested it, I'm not sure if it's what I want to do or not. And it's a time of the term that we now use called adulting. And I like that term because it really fits a lot of the young uh, people that I've seen go through this process. It's a time of optimism where they'll feel that someday they'll get where they want to be in life. And that's a positive thing until substance use disorder may get in the way. We know that this is a time to renegotiate relationship with parents or caregivers. The other thing I'll mention, since when we did this the first time, I had put in the Erickson developmental graph, is that two of the resources that I was just looking at this week said that this still is a very good fit, but they've just changed some of the terminology as you look at the list of things where they've listed down here infant, toddler, preschooler, grade schooler, teenager, young adult. There still needed to be that middle one put in there, but with these stages, they're still in the right order, which I think is good to know that some of that is still really important. So the stuff I used but learned when I was going to school is still valid. Sometimes it gets a little frustrating when it isn't. So the renegotiating relationship with parents or caregivers, uh, could be grandparents, other people, develop stable and productive peer relationships. We hope that as healthy development, that's what happens. Um, that as you move away from your family is what is your primary. You're going to have other relationships. You're going to have relationships with work. You're going to have relationships with professors, with teachers, with mentors. It's a time to meet the demands of increasing mature roles and responsibilities. And for people that are entering these stages and may have started using substances early on, that's a scary thing. How do I step into those roles and responsibilities? And this one is one that assume the role of parenting. When we first started the Resource Center, I said we started out with a focus on adolescence and how we get families involved. And then the funding moved to transitional age youth, which is what it was called at that point in time, and has evolved into the emerging adult. One of the things that I found very frustrating in the field, and some of you may have experienced some of the same things, is a lot of the family involvement. If you were looking at treatment services and different kinds of services like that for people experiencing substance use disorder and emotional issues, those kinds of things, struggling, we looked at how the family involvement included the parents, the grandparents, the siblings. But what was really frustrating to me, the primary sources were not looking at the fact that 18 to 25-year-olds, as I was coordinating outpatient services, more had children than didn't. Somewhere in there, there were children involved in that. Now, I will, granted, we had a contract with DCFS for substance abuse services for this area, and for outpatient services, that was a large percentage of our clientele. But I don't think it was that different than outside of our role in our area. Young people, those ages, assume a role of parenting. I did. In that 18 to 25, I had two children by the time I hit 25, and they've survived and doing well, although I'm not sure how sometimes. The living situations of our emerging adults is so, it's so different for different people, and there's a lot of different options. And some young people will experience all these in one person. They live on their own or they live with family and friends, and we know that there's a much higher level of young people still living at home, or they leave and they go out and find that it's a struggle and they need to come back for a while, or they're doing couch surfing. As we look at the homelessness that seems so prevalent in a lot of areas, um, there's a lot of couch surfing. I've had a family member that's kind of lived that way. They could always come live on our couch, but heaven forbid. And it's something to think about, or some kind of supportive housing, or if they've had treatment services, are they looking at a recovery home? You know, as you look at the ages of people that are in those situations and the homelessness, and so many of them, again, the source that had this again identified the fact that they often have children of their own, and where do they fit into these living situations? We know that we have children in our school system that are couch surfing with their parents, that are living with family and friends. There's a large number, I won't get into because that's a whole nother webinar, on the number of children that are living in kinship care and maybe with their parents, but of the young emerging adults. This is a time of big challenge, jumping from adolescence into adulthood. Looking at the psychology today. Okay, I've got to move something here. Whoops. Sometimes the screen doesn't want to cooperate. As we look at things that impact that transition in this time, experiences of children and teens definitely influence how emerging adults are influenced. And it's often by a choice of parents. And if we know we have parents that it's a positive experience, and we know that we have parents that it's not so positive. And that influences how you're going to go through this time of your life, remembering that a lot of the things that are happening are still influenced from the outside as to the brain development that's still going on through 25. Those neurons, the growth, the linkages, the patterns that are placed to function from. If parents make unhealthy decisions, oftentimes there's little control that a child has. And if so, if they're living in a home where there's substance misuse, I'm not even saying abuse, but substance misuse, and there's some unhealthy decisions made, there's arguing, there's those kind. The child doesn't have any control over that, and they carry that into these early adulthood years, emerging adulthood years. I'll correct myself. In the time of emerging adulthood, people can move to transform their lives away from or toward healthy environments. This is really the time that it's a turning point. If your upbringing up through 18, going into this time period, the EA period, as it's known in a lot of the materials that are out there, um, wasn't a really positive or healthy thing. It's a time where hopefully you can get the resources, if they can get the resources to change that and move toward more healthy environments. And if there's issues, hopefully they're getting help for them. Oops, come on. There we go. This is kind of just a quick overview. A lot of the research recognizing this stage. And early on, I had some arguments when I would start putting that into some of the work that I did. Oh, this can't be true. We don't really know this, etc. By the time they're 18, their brain's developed. We know it's almost fully grown to 3 pounds by the time they're 2 to 3 years old. And, those neurons are just going to grow. But at 18, they're fine. That's not true. In reality, we thought the brain was fully developed by the teen years, even basically by the early teen years. There was a lot of work done by Howard Epstein, I knew I'd remember it, on the growth of the neurons and the stages, because I used to do trainings on that. The neurons and the growth stages clear up through the early teen years. And at that point in time, he was someone that did a lot of autopsies and he'd study the brain and put out a lot of research around the brain growth and development of children and the stages of brain growth. And his conclusion was, from looking at his experience, that by the early teens, the brain was pretty well fully grown on into, and up to 18, things ought to be set. Well, we know now with the way we can do research and look at things that that's not true. And as that came out, I found it kind of exciting to read that and look at the contrast. Currently, evidence of the brain development is well into the mid 20s. And I even read a piece when some of this earlier research came out. We know that there's still a, 18 to 25. You sometimes wonder, why did they do that? Didn't they know there was a risk? What, et cetera, et cetera. There seems to be that draw to being a high risk time in life. And of course, I realize some of us never get over that, but looking at the stage and not thinking of the consequences. And there was even 2 or 3 articles put out that one reason it was known that they like to place young people into combat or into high risk areas if they were serving the country is because they don't stop and think about the consequences. They think about the adrenaline rush that they get from the risk. And I thought that was really pretty kind of interesting research. And in the moving to my office, I was looking for some of that and I couldn't find it. So I probably loaned it and never got it back. But we know that the neuron growth and the pruning of the neurons actually ends a lot later than we thought. So there was a lot more time for negative development of risk taking. All right, I've got to move something here again. Take a look at risky behavior factors. This is probably not new information for many of you, but I feel like we need to put it in here and kind of revisit it, thinking about those years, specifically those years between 18 and 25, thinking about the young people that you may know or have worked with. Risky behavior factors. The young brain is still developing, particularly the prefrontal cortex for decision making and impulse control, which is just exactly what I was talking about before. That that impulse control isn't as solid, and you wonder why in the world did they do that? And as they start to mature and develop and make better decisions, we'll kind of think to ourselves, well, they're finally adulting. But it makes emerging adults a lot more vulnerable. And that excitement, the adrenaline rush of things that they don't stop and think as much about or process the consequences. And we wonder why they ought to know better. Well, it's because their brain isn't ready to process it the way we as adults looking back think that they ought to. There are a lot of other issues, peer influence, social and environmental factors impact uh, how our young people are making that time through the EA, personality traits, mental health conditions. And I truly believe, having supervised outpatient services with so many at that age, I put this in here because I just love this. It's kind of fun to look at that. You wonder what in the world's going on in the brains of teenagers and as they move into EA. And it's kind of, it's everything but a lot of the things we think that ought to be there. So that was just a fun thing. But looking at the risky behaviors and the outcome of so many of those as I watched people going through outpatient services and I watched a lot of the decisions that they would make, and you would wonder, why in the world, when you're on probation, did you go do this or this or this? And if you'd sit down and start to talk with them and process it, it was obvious that they just didn't think ahead to what the consequence would be. And it really fits with what we know now as actual developmental issues that they were almost blamed for before. And it's not to say that negative behaviors should be excused, but it's how do we respond to that? How do we help them learn from those experiences? How can we build that stronger foundation as those brain neurons are developing and solidifying? Types of risky behaviors that we see in a lot of teens, but as they get to 18, 19, 20, they're more out on their own. They don't feel like they have to answer to somebody quite as much. The substance use, sexual risk, and sexual risk driving. I thought this was interesting. CDC specifically used this terminology, and I don't think I want to ask any more questions, but it's interesting to think about. Reckless driving. Now, back in my day, reckless driving, and some of this would have probably been all the drag racing that we used to do on the backcountry roads, but I grew up in the same place. I live on my grandparents' land in my own home. We built a house here, but thinking back of those things that I look now and I'm going, why would I ever condone my grandchildren or my children to do those things? Well, at that age, made sense to me. It was fun. It was independence. Social media and online risks are something I didn't have to worry about it growing up. But as I look at even my own children are old enough that a lot of this was not a part of their growing up. But I look at my grandchildren and how it definitely impacts the way they think, the things that they process, not always negatively. Some of it's good. It encourages them to do some things that they would do. In a positive way. It gives them ideas, it stretches their world, but it can also have, as we know, as the research comes out and as we experience some of the things going on in our world, social media and online risk is very definitely there. Other risky behaviors, delinquency and criminal risk. We know, especially some youth that grow up in homes where there's substance use disorder. If you go back to Virginia Satir or Sharon Weischeider Cruz's, uh, Claudia Black's things around the different roles that family members take when there's substance use disorder going on in the family, there seems to be a strong tendency for somebody in the mix to have some delinquent behavior or criminal risks. And part of that is pulling the attention away from the chaos because they don't want the outside world to know what's going on. Part of it is just trying to make themselves seen and recognized, and a lot of other reasons. But we know that that's one of the risky behaviors as you're going into being an emerging adult that follows you. And oftentimes it has a very negative impact on how the outside world looks at you and how they react as you're trying to grow up in it. And sometimes it sets up barriers and stigma too. We also know unhealthy eating habits come out of stress and stuff. This was in from a presentation we'd done similar to this before, and I left it in. I think most of the people on here, as I looked through how you were posting and what you do, it's nothing new, but substance use disorders, as you look at how SAMHSA defines them and National Institute on Health, et cetera, it's a chronic relapsing brain disease. It's characterized by compulsive drug seeking. It's considered a brain disease because drugs change the brain, they change its structure. The chemistry is changed. Brain changes can be long lasting and lead to harmful behaviors. Um, the more recovery you have, the more time that you have away from the substances, the brain will heal somewhat, but it doesn't always completely heal. And that expectation that just because they quit using, everything's going to be fine, doesn't work that way, folks. Again, association with substance using peers is a risk, lack of school connectedness, academic achievement, childhood sexual abuse, and mental health issues. Again, these are real similar. I left them in here because we'd used them with a little bit different focus, but looking as you go in to your emerging adulthood and out on your own, if you look back at your family history, what's there? What do you build from it or what do you change? If there's been favorable parents' attitude regarding using behavior, oftentimes I've always been very, I don't know why, as many years as I've been in the field, but there are times that I get really surprised that parents were actually the person that introduced the substance to their children. Poor parental monitoring, don't know where your kids are, et cetera. We'll talk a little bit about that in the family checkup. I want to keep an eye on the time to make sure we get it all in. And of course, the parental substance use, even if they don't invite the kids to use with them, the fact that it's there, it changes the dynamic of the health of the family. And if there's a family rejection of the sexual orientation of the young person, that can be very um, negative as to how they move forward. Let's take a look as to who the family members are. Family is defined by the individual in recovery. And I loved it when that became really clear a number of years ago when SAMHSA came out with their definition of family, said we have to stop looking at that bio as the only thing that's family. It's who the person that's experiencing the substance use disorder or the mental health issue or the co-occurring issue identifies as family. And I believe that because I have a lot of people that I consider family. I care about them, I love them, and I would think just as much of them as I would if I was biologically related to them. So that family's very diverse. It can be biological relatives, it can be legal guardians, spouses, partners, close friends. I had two close friends that were as close to me as any family member ever has been. Caregivers. and then the often forgotten role of parenting. It still gets lost oftentimes when you're talking about emerging adults. And with my passion for children and helping them get through tough times, I don't want that to get lost because we need to support emerging adults that are experiencing stressors in their life, that are experiencing substance use disorder or co-occurring. How does their role of a parent fit in? And if the child's been removed, how do we help that relationship grow back together? Maybe it doesn't mean that the parent actually gets the child full time or custody of them, but how can there be a relationship that's important and helpful to both of them? We know that according to the National Institute on Health, 42.5% of emerging adults are parents. And then Columbia University identified 19.2% are living with a partner. And then 1 in 3 are still living with their parents or have moved in and out. And they said it peaked in 2020. That doesn't surprise me because 2020 is when the pandemic hit, and a lot of people, as things became isolated, children move back in with, adult children move back in with their family, or the resources weren't as plentiful because everything was shut down. Uh, and Casey Foundation had a lot of really good data out about what happened at that point in time between little ones and their parents. We know if we can move emerging adults that are experiencing um, substance use disorder or stresses in their life that and go into treatment services, it always helps to just take a quick look at what are the benefits for families. And we're going to talk in a minute about the way the family might look with that. It improves treatment outcomes. It improves the client recovery. It improves the family recovery because a family that has someone that's using, I consider myself on a recovery journey every day. And my recovery journey is really living the serenity prayer. But that's how I keep myself balanced. That's how I keep myself committed. And some people would say committed where, but uh, committed to what I do, to have gratitude, to work toward that. And then looking at the intergenerational impact. If there's generational use and it's being passed down one to the other, that whole cycle, um, the benefit for the families being involved and being invited to being involved in services is very helpful. Benefit for providers in reduced resistance, flexibility in treatment planning, flexibility in treatment approach, increased skill set. That is important to look at it from the provider's angle, having been in that role, because the more involvement you have of the family and the more they can start working to put things together, the stronger it is for the children, for the family as a whole, for their recovery journey. And it's just important to take a look at that because family, if they can be part of the flexibility that we have in treatment planning and in a treatment approach, if they can be involved in that and understand it, there's not going to be as much uh, resistance. And someone that has that kind of support is going to do much better on their recovery journey. So we'll send them on one together. Influencing situations as you're going into providing treatment. This comes from several different resources that I went through and some of the stuff that I updated as you're looking at doing and working with substance use disorder in emerging adults. Critical elements in our social network. It looks a lot different than it was as I was growing up, and just the whole social media is a big part of that. There's a challenge to create a positive social network when there's so much negative and negativism in our environment. It gets in the way of treatment, and it depends on where you are. I mean, geographically, where you're trying to provide services and what the environment is and what the culture is definitely impacts how you provide services to this age. Uh, It's important to educate parents and family. That influences how well and how successful your treatment is. It's looking at addressing stigma. And as a country, thank goodness, and as a field, we are definitely working on addressing stigma. And I get excited and grateful every time I see a lot of the work that our ROSC councils are doing on reducing the sense of stigma and bias when it comes to substance use disorder. I'm one that says, share your story. Sharing your story may bring somebody else to be able to go through what they need to go through and reach the point of sharing your story. Having peer navigators and other people experiencing lived experience coming into our field the way we're bringing them in is going to make a huge difference in positively influencing our situations. And I have seen in our own area a lot of emerging adults that have had recovery that are now working back in the field as peer navigators or whatever title you put to that peer relationship. And there's just so much success with that that we need to be looking at that. Looking at what the cultural triggers are for substance use disorder in your area. Oops, I'm going to run out of time here. And then all facets of individual identities. You know, who is this person? A lack of recovery housing is an issue. It is no matter what your age, but especially for emerging adults. And if they have children, where do you go with a child if you still have custody of them? Discrimination within healthcare, variety between different groups that are out there, holistic approaches to recovery support. I think one thing when I was coordinating outpatient services, at least in our area, you didn't consider anything but AA, NA, et cetera. That was the only thing that was accepted as being self-help recovery support, period, in general. And now we have opened up this world to SMART, to celebrate recovery, to all these other resources. And I encourage you in January, attend Bob Carty's training on exploring multiple pathways in substance use disorder recovery. Bob used to be head of clinical services at Hazleton in Chicago. Bob's done workshops for us. He's one heck of a nice guy. He also wrote a book this last year that is very good. I read it, I have it. And he does a great webinar on the whole variety of recovery uh, options to support ongoing recovery, not just treatment, but what are those other resources out there? And I encourage you to take a look at that. And then how do you support people that come back from a relapse? Those all impact how you do. Developmentally appropriate social skills. We know this is important, and this came up in the article that Randy and Mark also helped with is we know that looking at the environment that our emerging adults have grown up in, everybody's got a phone, you can text, you go on all this stuff. Well, use it in a positive way. And that's encouraged in some of the treatment service um, reports that are coming out for emerging adults. Access your social media and smartphones in a positive way. They found that 12 to 25-year-olds, and I thought this was real interesting, some of the research, a daily text as part of their aftercare from treatment helps sustain recovery in a tremendous way. And it's recommended that it be set up that way. Doing telehealth, doing treatment, through Zoom or whatever it is, fits for emerging adults. It's an environment that they're familiar with, that they're comfortable with. The only thing that you want to be sure and do is if you're going to do it in that way, at least do one face-to-face session to start with. You have papers to be signed, et cetera, that needs done. I know there are ways to do it, even if it's on Zoom, but get that connection going, and then you can build on it as you're doing your telehealth, or if it's part of, it may not be the entire way you're doing, but it's showing that for emerging adults, this is a very strong support for them having a good start on recovery. And again, recovery coaches and peer navigators available in their own area. You may be doing the primary counseling, but having those peer navigators and recovery coaches available as support is really a strong piece of creating healthy recovery for emerging adults. Now, another thing to take a look at that came out of that article is expand perspective of supportive self-help group options. That goes back to what I was saying with Bob's workshop on all these different multiple, so that it fits in with their cultural activity, with the values that you grow up in, and addressing family involvement with the goal of healthy boundaries, not the relationship of a teen and a parent, but the relationship of an adult, and the change, that it's not the same. There's not the parent telling the teen what they have to do or all this. It's changing that role so that there's respect as adults for each. Thoughts that impact treatment services for emerging adults. Be really careful. They're finding that what often happens is and it kind of really, these two go together, that comments and assumptions um, that may be unintentional, may be thought of as a slam or whatever term you want to use. An example that was given in one of the resources was saying that a young lady walks into an appointment for an assessment for an opening, and she's in scrubs. And there's a comment made about, are you the house, do you have housekeeping, or, oh, are you a nurse's assistant, et cetera. So the assumption and making that response to it is a slam. You're not going to get anywhere. That first step has gone down the tubes, and be careful about those slights that you make. Sometimes it means really changing our language. Engagement also begins with the initial phone contact. I've believed this since I came into the field. And at one point in time, I was that secretary way back in my early days. The secretary that took that first phone call. You want to make sure that there's respect. It doesn't make any difference who it is. They need to feel like they're being respected as a human being. And that means that the receptionist and any other assisting staff, other than counselors and therapists and stuff, still have that same approach. When I was supervising outpatient services, one of the rules that I had, I won't say rule, one of the strong suggestions I had of the counselors that worked for me was, when you go and meet somebody that come in for their appointment, is offer your hand. If you're uncomfortable with that, work through it. If you are really concerned about doing that, find a way to at least recognize and let them feel like they're valued as a human and cared about. I would almost always, if I knew that we had a new client coming in or something, I would go out and shake their hand and introduce who I was. And, if you need anything, let me know. This is your counselor, et cetera, et cetera. People need to know that they're valued as a human being. And as you look at this information, I'm not going to have you take time to share because I want to give you a quick break, and then I do want to do the family checkup. Yeah, it's this booklet. They no longer publish it. It was out when it came out, about the time the Family Resource Center started, and it is the greatest tool, just basic tool. And Christina and I worked in putting it into a workshop looking at the family checkup, positive parenting. And we were able to take and look at what are some clinical applications for this, which is really important. And we know that good communication between parents and children is the foundation of strong family relationships. If we want to help people grow into being strong, healthy, emerging adults, this is a good tool. It's something that applies a lot of it just to any relationship. When the Resource Center first started and we did our website, we would print different sessions of this on the website for people because they really seem to like it. It helps parents, communication helps parents catch problems early, supportive support, positive behaviors that helps you learn how to do that. Stay aware of what's happening in the lives of your children. And I'm talking about children clear up through teens. This was primarily focused at teens anyway. And as you look, and we will send you the copies of these slides, as you look at the clinical application, there's a lot of positive in having strong communication with your children. And I'm not going to go through all of these. I'm going to go through the steps, and you can look at the clinical application when we send out the slides. To get started, you're going to choose a time when you give your child undivided attention. And that means that they feel like they're worthy of your time. And that's really important to kids. I'm as guilty as any other parent, grandparent, caregiver, whatever. I mean, I just think about last night, my 3-year old great grandchild, who's here a lot. Nana, Nana, Nana. And I was busy doing something to get a food for him. And it was just a minute, just a minute. If I would practice my own things that I preach, you stop, you get down and you say, I will talk with you. And you give them the attention, know that they were heard. She would have gone, sat down in the chair and waited for a minute for me to finish instead of Nana, Nana, Nana. And that was even as little as 3 years old. It's thinking that through, um, making sure that you have a plan of how you're going to handle those kinds of situations and a guide for conversation. Maintain calm and patient demeanor, especially if it's a stressful situation that you're addressing with some of your older children. Create a distraction-free environment. And in this world that we live in, that's really difficult to do. Another thing to do is agree on a time frame for conversation to keep it focused and respectful of each other's time. Even with my 8-year-old grandchild that we had guardianship of until she was 5. She was here last night. We still see a lot of her. I'll see her tonight. But we have specific times when we're together that she knows she has got my time and I will listen to her because I'm the backup. I'm the resource for some of the things that she's been through to how you navigate it. Looking at key communication skills, show interest and concern without assigning blame. Instead, you might ask, that sounds difficult. Were you confused? Instead of saying, how did you get into that situation? I mean, as I go through this book every time, it's like I can play back to when I was doing my first round of parenting and I'm going, oh my gosh, it's a wonder that my kids turned out as well as they did. And they did, college graduate, good jobs, good families, you know, but I could have really screwed it up doing some of these other things. You promote problem solving, what do you think would have been a better way to handle this? Is good tools to use with your clients. What do you think would have been a better way to handle that, especially if they're still in that brain development stage of emerging adults, instead of what did you think was going to happen when you don't think? You know, listen and observe. Youth are more likely to share issues with parents who listen without judgment. And that starts with even really little children. The more stuff that comes out lately about how we work with children that are at risk, um, and ones that have experienced grief and loss and things, recognizing that we have to listen. Listen is probably almost as important as responding. You need to control your thoughts and actions. And if you're too upset, don't proceed. Address it when you've calmed down. Uh, when you're not feeling as upset or angry, make a plan to deal with the situation. I can remember when our daughter wrecked a car from doing really what, in my opinion, of course, was stupid stuff. She to this day says, "You didn't get mad at me." And I'm going, "Well, you were my third child. It had happened before. You learned from that." But it was a matter of how you react and listen to what happened and help them learn from that. She hasn't had another one since. So maybe it did some good. We want to encourage our young people, help them build confidence, help parents promote cooperation. That's what you want to do. And you want that with your clients. You want to promote cooperation with your clients. You want to help them promote cooperation in their family and reduce conflict. There are three messages of encouragement that are really important. And I think this is true of anyone, even when I supervise employees. There's a lot of this that goes into that. You can do it, especially if they're new to the position and what's going on and the environment is strange to them and they kind of hold back. Well, you let them know that you can do it. I believe that you can do it. You have good ideas. You know, you need to listen. If you have young people, some of their ideas are a little out there, but just stop and think and listen to what they're really saying, and you may find that they really are good ideas, and let them know that they're important. This has a list of encouraging phrases. I'm not going to go through them all. I think that you as adults and as professionals for the most part have seen these, but you will also have these in the slides. But use encouraging terms and phrases rather than ones that accuse or ones that make them feel like they don't know what they're doing. What doesn't work is being sarcastic or negative. You know, if they burned the house down, you know, it's kind of what have you learned from this? You yourself may be thinking this. It's be careful how you say that. You may be frustrated, you may be angry legitimately, but how do you help the children grow from that rather than feel unvalued, uncared for? And maybe you need to take time on your own before you even address it. Don't compare a child to sibling or friends. My dad was bad about that. As much as I loved him, as part of his alcoholism, he had a tendency to want me to be just a little bit better. And I would get compared to friends' kids. I made it through it, but it wasn't a good thing. Taking over if a child is slow to progress, if they're doing a project, if they're doing something you ask them to do and it's taking longer than you want it to, don't just jump in and take it away from them. Ask them what they can do to have better timing, or ask them if you can show them. Don't just take it over. Negotiate. It's so important that we learn to negotiate. Any relationships that way. You know, in my marriage of many, many years, I've certainly learned how to negotiate. But I have with my own children as adults when things come up and we need to talk about things. I have with my grandchildren. You know, by learning to negotiate, it helps you learn how to work together a lot better. You can solve problems, you know, and be able to make changes without a lot of resentment and people um, not wanting to see each other. And it helps improve cooperation. Doing negotiation, that's a skill that you can teach your children. We get concerned about all the bullying and things that are going on in our environment and that's going on in our children's environment. Some of these skills can help them handle that and help them focus on solutions. That's one thing that I have grown into in pretty good form is really learning on how we can do things differently and make it a learning situation rather than a problem that just sits there. And it helps develop communication skills. Tips for success. To address issues effectively, opt for a calm, scheduled time. And sometimes in our crazy busy world, that's hard to do, but it's worth it. Even if you have to put it off a little while, it's worth it. When it's calm, you can address it, you can handle it, and if it's been a crisis, that you can really process it. Choose a neutral, distraction-free environment if there's something going on with your youth that you really need to concentrate on. I still say to this day, a good place to do that is when you're in a car going somewhere because youth, especially preteens, have a tendency to talk to the windshield, even though they know you can hear. But it's that it seems to be a safety barrier for them. And I'm not the only parent that feels that way. I've heard that said many times. Concentrate on small, specific issues. Recognize the other person's positive contribution to it. If it's an issue that involved you and another person, do you have any responsibility for it? And if you do, admit it and take on that part of it. Paraphrase what you've heard to disseminate an understanding. In other words, it's that reflective sharing back of what you heard, and take a break if emotions start to rise. Just say, okay, we really need to take a break before we say something that we don't mean or that we're sorry about. Steps to problem solving. Encourage brainstorming by generating 3 ideas each. Take turns. List the positives and negatives for each idea. This is a great tool to also give to your clients. Ensure everyone agrees on the chosen solution because so often their relationships are in such trouble, and with family or whatever relationship they're in, helping them go through a brainstorming to problem solve and make it a solution rather than a problem is a great idea. Ensure everyone agrees on the solution and then follow up. You do an assessment. If it doesn't work, and your evaluation shows that of the process, you try it again. Address pressing issues. Assigning blame or belittling the other person is something to avoid. It's easy sometimes assuming the other person's intentions. That is a dangerous thing to do. And I think all of us at some point or another have probably done that very thing. Defend yourself. Practice the art of letting go. If you carry all this garbage around, it's going to make you crazy. It's going to stress you out. It's going to make you unhappy. It's not going to help your relationship. Let it go and move forward. As they say in AA, let go, let God. Move forward. Rehashing past grievances, digging it up doesn't solve them. Moving forward so that you don't repeat those does. We know with all of this that it's still really important to set limits, especially for young people. Establishing rules, create clear rules and that are simple and specific, even if they're teenagers and close to 18. Simple rules. Don't make it complicated. Ensure that your youth comprehends the rules you've set. Have them repeat it back. Think about their learning styles. Listen to the way they talk. Do they see? Do they hear? Do they feel? Respond to those and make sure that they can repeat back with their own learning style and understanding what you've set. Maintain a list of consequences for rule breaking and be prepared to follow through. Don't set consequences that you can't do. Those threats that we have a tendency as a parent to do when we're under stress, it just backfires. Consequences for rule breaking and encouragement for rule following is important. Stay sane. I know you're all probably going, what do you mean stay sane? It's not easy to do, and that's true. Remember, small consequences are better because it's probably something that you can do. Avoid consequences that punish your child. You want something that disciplines, not punishes. You want non-abusive responses. You don't want your children frightened of you. You want them to feel like they can come to you in the worst of situations. And think about effective consequences when you're setting limits and rules. with effective supervision that enables parents to keep track of their teenagers' location, friends, and activities. And with cell phones these days, you can track their location. Identify potential concerns early on. Don't just push things off and say, oh, it'll get better, or I'll just have to wait and see what happens. Address issues as you see it coming up before they escalate. And if you're concerned about mental health issues and behavior challenges, monitor it and get help when you need it. And realize supervision isn't an option, it's the foundation of effective parenting, clear up through adolescence. It's going to have highs and lows. Your responsibility it's not going to lessen, but it's going to change, helping them develop into a more effective person entering those emerging adult years is really important because you can set a strong foundation using these tools. Influence is power. Oops. I'm trying to move this out. This is just ideas that have been thrown out to do together. Spend time together, play board games, tell family stories, encourage positive activities away from the screen. There's a lot of research coming out just really in the last couple of months about the long-term damage that they are finding with the brain development of children that have spent a lot of time on the screen moving into adulthood. And what is that going to do with the emerging adults and some of their abilities? Because this is new research, but it's out. We're starting to see it come out. I haven't read enough of it to be able to repeat it to you, but I find some of the, I guess what you'd call cliff notes or whatever, um, concerning. Include your child in social events whenever possible to teach them how to get along. Include your child's friends and family activities. Get to know who your kids are hanging with. And you can use these tools in treatment. I've said that all along. Use motivational interviewing to explore parenting goals, role play conversations with your clients so that they can practice how they're going to address issues and concerns that they may have with their young people. And if you've got emerging adults, they could have anywhere from newborns to 5, 6, 7 year olds, that it's important that they have those tools and these tools to build a positive relationship with them as they're working on their own recovery. Help clients write or practice letters to their children. Refer clients to parenting support groups and peer monitors. And reinforce that healthy parenting strengthens recovery and family stability. There is absolutely no doubt. And it's very important. A lot of information, pretty fast. Okay. The name of the book that you can look it up online, Kara, is Family Checkup. Positive Parenting Prevents Drug Use. They don't have the booklets anymore, but you can get the materials online. That is still available. I will be sending out the slides to these probably next week, both sets for the first part and the second part. So we'll get those out to you because we're just kind of wrapping down the first half of the year that has been very busy. So I want to thank you all, and I want you to have safe and happy holidays, whatever it is that you celebrate. And if you have any questions, email me, and I will be glad to do what I can to help. And if you want to fill out the survey that pops up here, that would be fine. Otherwise, I would really appreciate it if you would fill out the evaluation form that Christina posted. And if you didn't catch that, we will be sending it out. You don't have to redo it after you've done it once. We'll be sending it out again when I send out the slides. So thank you, everybody. Be safe. Be safe with the weather that's coming because I think it's statewide and it's important. you're important, and I want to thank you all for everything you do for the families in Illinois. And that's about it. Again, be safe and have a good holiday.